Now, tell us about taking Max GXL. Is this an intricate process with lots of containers and things like that? Do I have to mix things? When I get Max GXL, what am I doing?
Take one of the little packets, open it up, get a glass of water, and swallow it because it is encapsulated. Basically, you can take it with food or before food or after food, and there doesn't seem to be a difference in terms of glutathione. The absorption is still facilitated. I guess that's the easiest way of saying it. And I'll tell you what I do, because I don't live on a clock. And the usual dose of Max GXL is 3 twice a day, usually in the morning and after lunch. I do that, okay? And then very frequently I have to lecture at night, or I've got a late dinner, or I've got a late meeting. I get into what I know now, and this took me a long time to figure out, as what I euphemistically refer to as the zone. Don't ask me what the zone is because everybody's zone is different. But it's when everything's working, okay, there's nothing out of sync, all the cylinders are meshing, all the gears are working. As soon as I feel even the slightest thing occurring, not by a clock, but by my body clock, I'll take more Max. The only thing I will not do is take it within about 3 to 4 hours of going to bed, because then my body keeps working when my mind wants to say bye-bye.
Okay, so if I heard this right, you're telling me it's in capsules, so it's easy to take. I can take it when I need it, not on some strict regimen. Well, that sounds pretty simple. I think I can actually do that.
I hope so. But the concept that I don't need it because I'm normal means that you're living in a bubble, you're not exposed to oxygen, you have no stress, you're eating perfectly, and you're getting 8 hours of sleep a night. If that defines you, then maybe you can do without Max GXL. But for me and the rest of the people on this planet, I believe it's absolutely necessary to prevent the rust that will ultimately lead to your demise.
If I start taking Max GXL, how quickly am I going to feel results?
Depends on how empty your barrel is to start with. Those people who are ill, the ones that I'm privileged to treat in the clinic, experience a change within a day, and sometimes even quicker than that. In fact, one of the distributors for Max was here about a month and a half ago and had gone for 2 or 3 nights with very little sleep and was kind of on his last legs. And while we were talking, I said, well, just take it, and you tell me what happens. He said in a half an hour, he stopped the conversation and he said, man, my brain's starting to work. I feel awake, and I was essentially almost asleep when I walked in here. So it can work that quickly if you're down far enough in the barrel. On the other hand, if you are only a minimally rusting pipe, okay, you may not experience any real change. However, you will notice that if you stop it, the change that you didn't think you experienced will then occur in a very negative way. So there's 2 ways to look at it. If you're close to the top, it's going to make it even better and protect you, but go on it for a month and then decide to go off it for a week. And you will notice all of the things, as my mother did, because she told me it didn't work, okay? And then she stopped it for a week and called me and said, I'm sorry, I made a mistake. Get me back, okay? So it really depends. I can't tell you in any given person who's gonna be low on the barrel and experience boom all of a sudden, or who's gonna go like this because they're already close to the top. It will work in everyone. It will stop the rusting of the pipe. That is an inexorable process that goes on with being part of humanity and living on this planet.
Is glutathione created and utilized by just certain cells in my body?
Yes, it's used by certain cells. They're called all the cells. There is no cell in your body that doesn't use glutathione. You would say, but wait, that's silly. Let me tell you again a perfect example. I did a chapter for a cosmetic surgery book last year on antioxidants for the skin. And I hadn't done a lot of work in skin research in terms of antioxidants. I knew the generals, but I didn't know all the particulars. Glutathione is the most important antioxidant in the skin. Glutathione protects you against sunburn. Glutathione protects you against wrinkling. Glutathione protects you against the inflammatory process, the end result of which is cancer.
Well, we're all concerned about that.
I didn't say it would treat it, but it will protect you. It will give your skin a much more youthful appearance. And as your skin goes, so does the rest of your body. So if you're noticing a change in your skin, understand well that that's also true of your brain, your heart, your blood vessels, your kidney, your liver, and your little toe.
Everything.
Everything.
Wow. So Max GXL can assist in age management. Well, what are some of the other quality of life areas that have improved for your patients because of Max GXL?
The first area that I need to talk about is mental acuity. They can think better. Yeah, one of the things that happens is that they remember where their keys are. They don't have to think about, and this has happened to a number of patients. They've gotten to the store and they can't remember what was on their list, which of course they left at home because they forgot to bring it. All of a sudden, those things become much easier for them to deal with. A second one that we've seen a lot of is a marked improvement in their ability to do things, which I would translate into energy.
Okay.
The fact of the matter is, instead of getting up at 9 o'clock in the morning and lasting till 10:30 before they have to take their first nap, but you'll see a rather interesting stepwise increase where it goes from 10:30 to 1 o'clock, and then 3, and then they take more, and then 5, and then 7. They're still going to bed earlier. They're still getting their 8 hours of sleep. But during the day, they can accomplish more of what they wanted to do. And from a patient's perspective, the ability to be able to do things that you want to do and not have to worry as they did before. So you just see this wonderful unfurling, if you will, of the person's ability to re-enter life.
Right. Quality of life. That is the issue.
And the answer is that there was a very close correlation between the increase in glutathione levels and a measurement of the quality of life, which is called an SF32, which in essence asks you 32 questions and from that extrapolates what your quality of life is. If you looked at the beginning, glutathione's low, quality of life low. Looked at the middle, okay, glutathione's higher, quality of life higher. Now, I would never do this because I don't believe that it's appropriate in a clinical setting to take something that's working away from a patient. However, there is this thing in medicine called compliance, where people of their own accord decide they don't need it anymore.
I feel great. I'm done.
Absolutely. What we found was a month later, glutathione's down, SF32 down.
Well, what happened to me?
We have a number of patients who come here somewhat repeatedly, and they'll feel great for 3 months, and then they'll come in and I have no energy. I can't do what I wanted to do. I tried to cook dinner and I crashed in the middle of it. When'd you stop? And the answer is invariably, well, I ran out a week and a half ago and I knew I was coming here, so I thought I could wait. Guess what? You can't.
I saw a graphic that indicated some lab results from 4 test groups that you did. Tell us about those test groups and what happened as they had the opportunity to take Max GXL.
Well, actually, one of the test groups would be what you would kind of blanket into the normal group, because one was just an acute viral infection. So what we found in people with viral infections is their glutathiones went right down the tubes, okay? But if we put them on Max, okay, the glutathiones came right up to where they were before. And there's not enough evidence for me to say this with any degree of surety, but it is very clear that symptomatically they improve much more quickly than they ordinarily would. In the HIV patients, in the chronic fatigue patients, in the hepatitis patients, in the cancer patients, the glutathiones went up, their SF32s went up, they felt better, they did more, they participated more in life, and when they decided they'd had enough and became non-compliant, every good thing that happened while they were taking it disappeared.
Now, Dr. Keller, I'm sort of at the tail end of the baby boomer generation. And as we baby boomers are getting older, we're looking in the mirror and we're saying, wait a minute, that's not what I looked like 20 years ago. So I know I need to do things. I need to take care of myself. So I'm taking supplements, I'm using lotions and potions. I'm trying to stop this aging process. Now, the age management market is going to become huge. It's going to continue to grow and to grow. How does Max GXL fit into that picture of this burgeoning age management model?
It's an indispensable part of it, because if you come to me for age management, I'm going to measure your hormones. I'm going to measure your cancer markers to make sure that they weren't there. Okay. I'm going to measure your immune system. I'm going to do all of those things. But most importantly, I have to give your body the things that it needs to prevent the rust. And that predominantly is Max GXL, for all the reasons that we've talked about. So I can do all the other things, but if I don't do that, if I don't put glutathione back in the mix, if I don't reduce inflammation, I haven't achieved anything, because I'm still allowing that rust to occur. And Max is a critically important, I would call it a central component in an age management schema.
You mentioned inflammation. Now, when I think of inflammation, I think of swelling, like when I twist my ankle or a bruise or something like that. So how does Max GXL, how does that impact inflammation?
You're looking at inflammation on a gross level. So certainly if I sprain my leg or I break my arm or I have a heart attack, we all will understand that as an inflammatory thing. But the fact of the matter is, inflammation is a process that goes on day to day in your body as an obligate result of not having enough antioxidants around. And as a result of that, having these free radicals that incite cells in the body, particularly and peculiarly monocytes and lymphocytes, to produce a substance called nuclear factor kappa beta, which starts the entire inflammatory cascade. Now, the question that would come up is, do you feel it? Nope.
You say, I don't feel it?
You have millions of cells inside of your blood vessels. If you create something there, there's going to be cellular inflammation at that level. And you know what that leads to?
Tell me.
That's the way cholesterol gloms on to the inside of your blood vessels.
Through inflammation.
That's right. The end result of that is called atherosclerosis. But atherosclerosis doesn't start because cholesterol just decided to light onto the blood vessel. It's being invited in by that inflammatory stimulus.